Wednesday, 14th of May, as we welcome someone who's been here before. You folks might recognize Dr. Steffany Mohan from Plaza Dental Group.
We've just learned that she does not do liposuction.
Yes, that's not. She's not practicing.
Well,
liposuction.
we didn't know. You know that little sucking.
Yeah.
We didn't know if it had other purpose.
Jackie and I are going to borrow that and see if it works.
I didn't start that conversation.
I know, right. It's my fault.
By the way, it is time for great smiles. We'll give you some advice of how to keep your smile looking bright. And one of the things that I like to address first and foremost, electric toothbrush, like a sonic type toothbrush, or regular toothbrush?
Yeah, so a sonic toothbrush is what I love. If you use one, generally you would never go back to a regular toothbrush. The manual toothbrushes are great, but you know, as we get older, our dexterity kind of gets slower and slower, and you just really can't do with a manual toothbrush.
Okay, now with a manual toothbrush, maybe some people don't have the funds right now to get an electric one. Okay, which is fine. And some people just like manual toothbrushes, the old-fashioned kind. When we go, I want to scrape everything off my teeth that are on there, and when I get a toothbrush that is so soft that I can just blow on it and the bristles move over. What about a hard, stiff brush as opposed to a soft bristle brush?
So a soft bristle brush is what you want to use because
it won't get the stuff off your teeth, though, will it?
Though it does. It gets the stuff off your teeth. The hard bristle brush, which are hard to find if you have gone looking for them.
Kidding.
Yeah, there's a reason, because they're not good for you. So the hard brushes are the thing you want to use, or the thing you don't want to use, because they really kind of mess with they can kind of give you recession, and they kind of push the gum tissue back, and it's not healthy for you. You don't want to use those.
So the wire brush from my parts cleaner wasn't a good idea?
But that's where a lot of people that like to brush really hard, when they use the sonic toothbrush, they don't have to push hard on it, but it cleans really well.
So the sonic ones obviously send out sound waves that are at some wavelength that helps bust up the plaque.
It does. It's not really even a wavelength. It's just it just really
vibrates it, doesn't it?
It does. It moves very fast, so it's able to do something that you can't do with just your hand, you know, in a toothbrush. So yeah, it's many cycles per second. I wish I should. If I'd known you were going to ask me that question, I would have looked it up.
That's fine. All right. Now, what else do we want to ask this young lady about?
Well, what are some great ways if people are out there, you know, enjoying some breakfast this morning and starting their days? What are some simple things they can do to make sure they have a great smile?
Well, one of the things that I like to tell people is that pretty much everything that we help people with, that we take care of, is preventable. So dentistry, people don't like it generally, right? So it's not something that you just love. I mean, some people love to go have their teeth cleaned. Some people love to go have their teeth whitened and that type of thing. But most people don't just they don't skip to the dentist and think that it's going to be really awesome. And so the thing that I always tell people is it's sort of the, you know, ounce of prevention is the pound of cure. So the prevention is so important. So a little bit of brushing, a little bit of flossing, it goes a long way.
Okay, let's talk about flossing.
Yeah.
Thank you. That's where I wanted to go too.
Let's talk about flossing, because I've heard that can make and break your teeth, even if you're an advocate of brushing morning and night.
So if you're the perfect brusher, you do an amazing job brushing, you're still missing about 35% of the tooth structure.
Wow.
Yeah, the tooth surface.
Much?
Yes. Yeah, all that stuff in between the teeth. It's a lot.
Okay, now I'm not a fan of sticking my own fingers in my mouth.
Awesome alternative for you.
Okay.
So you can actually, water picks are great.
Really?
So you can use, you can shoot water in between the teeth instead of the floss.
It does the same thing?
It does a really good job. It's a good alternative. So if the compliance of flossing with the human population is about 0,
give or take,
somewhere in that range, then the water pick, people like to use it.
But you can't carry a water pick around with you when you're going someplace.
True, but there's a really awesome one. The main thing is that if you do it every day, at some point during the day, it's not so much like, you know, if you go to dinner, you want to kind of get the stuff out of your teeth. But we use at our house, not to give away too much because you don't want to know a lot, but the shower floss, you can hook it up to your shower head, and it works just like a water pick. So you just take away a little bit of the stuff coming out of the shower, and it comes through the little water pick that you can hook up to the shower. It's about $20.
An old dentist who swore by that, and he had one too years ago, and he had it right in the shower.
Where do you get them?
I've never even heard of this.
I haven't either.
I get most things online, which is terrible. I have 4 children, so I'm kind of, you know, I don't just run to the store every time.
Because they have all the shower heads.
They might. They might.
Or
don't know.
maybe
It's a good question.
Fleet
Look it up,
Farm.
Parkin.
Fleet Farm.
There we go.
Yeah, shower and floss. Where can we get
Fleet
it?
Farm or Menards. See if you one of those guys have
exactly.
it. So
Okay.
we're going to find that now.
Yeah.
What I have been,
my
to be honest
favorite.
with you, when it comes to flossing, I'm not too bad at flossing, but I use the picks.
Yep.
The hard plastic picks with the floss string across it.
Yeah, those are great.
Okay, I do
It's
those
better
now.
than nothing. It's better than nothing.
Better than nothing.
Yes.
Better than regular floss.
Well, floss, the great thing about floss is that you can wrap it around the tooth, so you can really get all the way along the tooth surface with floss. So that's, I mean, floss is the gold standard. I mean, that's what you really should be using. But the water pick and the shower floss and the floss picks are great.
Okay, now speaking of floss.
Way better than nothing.
When I used to be able to go, and you're the same way, Jackie, when we go buy floss, you just go, I'll take some floss, please, and then there's one row of floss.
Yeah.
Now when you go get floss, there is a rack about this wide. You have the ribbon floss, you have the floss that has diamond particles
wax,
on it, and
cinnamon
flavor.
You don't want to be chintzy on your floss. You want to get the good floss, you know.
You want the ribbon floss, or you want the fishing line string?
There are a couple of flosses that are really great that don't sort of get stuck and they don't shred.
Yes, that's the problem, because they'll break.
Glide is a really good one. Satin floss that Oral-B makes is a really good one. They don't shred, and they sometimes the floss will actually break.
Glide.
Yeah, write that down.
I am, because that's the biggest problem I have. Glide and satin.
Yep, satin floss. Those are my two favorites. So yeah.
Okay. And that's one thing you're saying it needs to be done every day. Is it twice a day, once a day, or just before you go see the dentist?
If you floss once a day, you are so far ahead of the curve, it's not funny.
Sweet.
That's the one you have?
So, yep, you just put a little. Oh, you know, that's a bigger one. That's a new one that just came out. But the little shower floss are just like little attachments that go on your shower.
Okay. Yeah, Waterpik makes one that just attaches to the shower, but that's a great idea.
I've never heard of that before.
Yeah,
okay,
crazy.
well, we're going to be scouting around.
The most important thing is, you know, it's sort of like anything in life. You know, you do the best that you can, and you should, you know, do it if you can, but you know, take good care of your teeth. People really miss them when they're gone. Yeah.
Yeah, that's something that's very important.
It is. Yeah.
So take care of your incisors and your molars, and what else we have?
Yep.
Incisors, molars, what else?
Premolars.
Premolars, okay.
Yeah.
Canines.
Canines.
I have 3 of those at home.
Yeah.
So anyway, well, well done. So when are you coming back?
I'm a couple weeks.
A couple weeks coming back.
Nice.
All right. Well, I'm looking
Okay.
forward to this, because if anybody else has any other questions when it comes to your oral health, just send them over. Send them to us, and then we'll pass them along.
Yeah.
Here's Plaza Dental Group. They're located on Jordan Creek Parkway, Suite 100. DMSmiles.com. That is a great website.
Thanks.
That is a great address for a website too. So DMSmiles.com, and you're good.
Next time I'm gonna brush my teeth better.
And next time, I want you to bring a chart, if you can.
Okay.
If you remember this,
Sure.
seriously, like a whitening chart, to see if people are keeping their teeth white or not, because it's amazing to see what color your teeth really are and what color you think they are. Okay.
I don't want to go there, especially after drinking coffee every day.
Problem,
That's
yeah.
what I'm
Coffee.
guessing.
Well, next time we'll talk about how to drink coffee and still have white teeth.
Nice.
Perfect.
Wow.
You just had somebody come back. Thank you so
right.
much.
Okay.
Doctor, thank you so much.
Thank you.
And we'll be right back. It's 9:22. This is Great Day. Smile, everybody. Smile.